welcome, Nicole. Thank you so much for joining us at the Virtual Patient Symposium. I'm so grateful that you're getting a chance to chat with us. So, for the listeners and the watchers who don't know you, can you briefly tell us about your husband's kidney cancer story and your experience as his caregiver?
Absolutely. So a couple of years ago, Keith had complained about some abdominal pain, mainly lower, and it would radiate into the groin area. His job is very physical. It would come and go. There was no real rhyme or reason to it. So he just let it go. He also works at the hospital with his provider. So he was embarrassed to make that phone call and get in there for that reason. Then he winded up, it got progressively worse and more consistent. So when that happened, I convinced him to schedule an appointment with the primary care. He had that appointment for a Friday. On Wednesday, the 2 days before that appointment, I came home and Keith was wincing just to sit down or to bend over to pick up something. So I told him we probably should go to the emergency room. He was reluctant, but he did agree. We went into the emergency room. He's well known, well loved there. We're laughing, we're joking, we're talking. The ER doctor knows him. He says, I think you might have a hernia. We're going to do a quick CAT scan and get you out of here.
Mm.
People were just talking, we were honestly just having a good time waiting, basically. And then everything stopped. We were there for 2 hours and then 3 hours. Waiting and waiting. They had been very quick and efficient up until that point. And the doctor came in and I could see that he had a serious look on his face. I thought they were going to say, hey, we have to repair this hernia. You're going to have surgery today or tomorrow. And he sat down and he had tears in his eyes and he said, Keith, you have a mass on your kidney and it appears to be cancer.
Mm.
When that happened, Keith just stared in a state of shock. We're young. That was definitely not anywhere on our radar. I literally went into get me out of here mode. So typically I'm a question asker. I could not utter a single word because I knew that the second that I started to talk that I would start sobbing, and I knew everybody knew us. So I was psycho grabbing our stuff to get us out of the hospital. I'm like grabbing his stuff, helping him get dressed. In my mind, I just kept thinking I need to get out of here. Keith had to help me out to the car. And then I got into the car and I sobbed like I never have before. I called my mom. She knew we were in the ER, but she said, call me if it's anything serious. And that started our kidney cancer journey.
I don't know why, but that just you telling that just made me like really emotional. I think it made me think about not to make it about me, but just first hearing the words that you have cancer could be just so emotional, and just to hear it from you as a caregiver, just really understanding it that way. And so just going on those lines, I feel like your first thoughts when you were told that your husband had kidney cancer, after you got out of that like fight mode or that flight mode, what were some other thoughts that came to mind, and how you were going to handle this together?
So my very first thought, which I'm now ashamed to say because I know so much more now, was I translated what the doctor said to mean you're going to die. That was my very first thought. My husband's going to die. This was a death sentence to him. My second thought is, how am I going to tell my son?
Mm.
We have a son, he was at the time 20 years old, really just starting to live his life. He loves his dad to death. And the thought of telling him was just absolutely devastating to me. So once I literally cried for 3 days. I've never done anything like that before. I'm typically pretty positive. I remember going to bed with tears running down my face, waking up the second that my eyes were awake, and I would have tears running down my face. I did that for 3 days. We had, so many friends and family contact and all of those things. But the third day, I just got up and I said, I'm not going to do this anymore. I've got to help him. This is not helping Keith at all. So I did, one of my fears during that time was Keith getting so discouraged that he would give up. Keith
Mm,
has had an extensive health history his entire life since a child. And so I knew in his mind it was like one more thing. I have one more thing to deal with. And I did not want him to give up. So I devised a plan to get the wristbands going that says pray for Keith and the kidney cancer orange. I passed those out. I did a social media campaign on Facebook. I had over 500 of those out in just 2 days.
mm.
I wanted him everywhere he went in that hospital to see pray for Keith on their wristband just to encourage him. And everywhere he went, he did. And that was what I had to do. I couldn't fix the cancer, but if I could help encourage him, then that's what I had determined to do.
You sound like an amazing support system for him. But what about you? So during this time, like what were the support resources that you had to help you get through this as a caregiver?
Absolutely. So I think of the three core things, which is faith, family, and friends. My husband and I have always been churchgoers. We're very active in our church. Knowing that God had a plan for me, He has a plan for Keith, and that He wasn't going to leave us through this. You know, He's been with us through a million other things, and cancer is no different. He knew he was going to get cancer. That was huge for me to know that and to hang on to that. My family support group was absolutely amazing. The night that Keith was diagnosed, 2 o'clock in the morning, my sister's over at the house. You know, I'm balled up on the couch sobbing, and she's just there. Um, 2 days after he was diagnosed, you know, my best friend, she took me out to lunch. She's my ride or die girl that, you know, I can tell her anything. And those resources is very important for a caregiver. You have to have that person that you can be brutally honest with your feelings, with what you're going through. You cannot continue to help a patient or your spouse or a loved one without having that support group yourself. It can be very demanding at times, and those things really just kept me going, honestly.
What are you doing now differently? How do you view life differently? What are some things that maybe you never thought you would have done before that you decided to say, you know what, now is the time to do it?
Yeah, so one of the things is letting go of that constant anxiety and fear. I used to, with his lab work pre-cancer, I would fret all day, worry about him all the time. Now, that's still here in a different way because now you have cancer in the scans and all of those things. But just to let go of that and get control of my thinking so that today, right now, Keith is fine. And I want to enjoy him right now. I don't want to worry about what happens 10 years from now. I'm a very planner type of person, so that has been very hard for me in my life. But cancer has really motivated me to tackle that and get rid of that thought process, which honestly was toxic to me, but I didn't realize it until he had cancer. Because honestly, if you could have given me a worst case scenario, him being diagnosed with cancer would have been it. So it really made me come to terms with that train of thought and just learning to live in the moment right now and enjoy him and the life we have now.
Well, along those lines, what advice, like what piece of advice, and multiple pieces if you want, would you have for someone going through a similar experience?
Yes, so I have thought on this, and it's so hard because I feel like we could spend hours on it, honestly.
Sure.
Um, One of the things that when my mind gets scared, fearful, um, I'm maybe angry, feeling lonely, all of the feelings, and your mind kind of starts turning to mush and it's swirling and doing all of these crazy things. I go back to the core reasons that I am a caregiver. And the first one for me is the who. That's the man I love. He is not a name on a schedule. He's not another
Hmm.
appointment. He is not a lab result or a CAT scan. He's my high school sweetheart that I love dearly. So that really helps me get focused and getting to the very simplicity of why do I do this? And why I do this is Keith did not ask for cancer. We didn't ask for this path, but this is what was given to us. So I want to do everything I can to help his journey be easier. Um, and give him the best life that I possibly can. When I look at it like that, he's not a burden to me. Now it becomes my honor. It's a gift that I can do this for him. And that's what I have to do. I have to get very simple. You have to just go to the very bare basics when you start getting that overwhelming feeling.
Now, is there anything else that you would like to share that maybe we didn't touch on in our conversation?
No, other than I would say, to keep it simple. And you're normal. As a caregiver, you're completely normal. You're not a bad person. You're not selfish. If you get angry or frustrated or tired, those are all extremely normal emotions and feelings. That doesn't mean you don't love the person that you're taking care of. That just means you're a normal human being. After Keith had his partial nephrectomy, um, and everything settled down, that is actually when I started processing what happened. I remember
Mm.
driving to work and going, he actually had cancer. He really had cancer. And I had to process that. And the other thing is just making the positive out of whatever you can. Keith and I had started Keith's Calls. We donate locally and to different kidney cancer patients. We go to the hospital, we make visits. We weren't doing that before he had kidney cancer. It helps us to take the focus off of what's going on with us and to put it on other people, to help other people. And it has just really healed both of our hearts.
Thank you so much for sharing your story and also for reiterating that it is human. I think we tend to forget that across the board, whether we're a caregiver or a survivor, that is like human to have these emotions, to have these feelings. So thank you for reiterating that, and for sharing your story.
Well, thank you so
Mhm.
much for having me. I appreciate
Of
it.
course.